Dr. Carpenter, thank you for getting together with us today.
Pleasure.
How common is seasonal affective disorder, and do we know what causes it?
Seasonal affective disorder occurs in about 3% of people, and it's one type of depression. You may have heard of other people referring to major depressive episodes, and those occur in both people with unipolar and bipolar depression, and maybe 1 in 10 Americans will experience major depressive disorder. Seasonal affective disorder is one type of major depressive disorder, and again, we think that happens in about 3% of the population. Twice as many of the patients with that problem will be women than men.
What are the main symptoms?
The main symptoms are not exactly the same from one person to the next, but there are some defining symptoms which clearly make a depressive episode warrant the label seasonal. So first of all, it has to be temporally related to a change in the season. Most commonly, we see seasonal affective disorder experienced as an onset of symptoms in the fall and winter when the daylight is decreasing. But there are some patients who will experience the reverse, where the onset of their depressive episode is in the spring and in the summer. So that's the first thing. It has to be tied to the season, again, typically fall. Some of the other characteristic features are similar to the types of things you experience with all types of depression. Diminished joy and pleasure in things, changes in energy, changes in sleep patterns, changes in ability to function and think clearly. Particularly for those who have seasonal affective disorder, we tend to see a pattern of oversleeping and overeating. So instead of having a depression which is characterized by decreased appetite, we're looking at patients who have increased appetite, and in particular craving for carbohydrates. And instead of experiencing a depression with insomnia, people with seasonal affective disorder tend to have hypersomnia, or increased sleeping, more napping during the day, more need for sleep, and lower energy. It's almost like hibernating, a little bit like that in the winter. So needing to eat more carbs, feeling the need to hibernate, and then having other symptoms of depression, which again may involve thinking symptoms, pessimistic and hopeless sorts of thoughts, negative mood, difficulty enjoying things that once were pleasurable, hobbies and interests, socializing, sexual activity. The things that are usually pleasure-driven for people are diminished when they have depressive disorders.
So what are the most common treatments for seasonal affective disorder?
Well, we have several types of treatments for seasonal affective disorder. There are a range of medications that work, and many of them affect serotonin in the brain. They're ones that you're probably familiar with, such as Prozac and Paxil and Zoloft and Luvox and Celexa and Lexapro, and many of those have generic forms too. Those drugs have fairly well established efficacy for the treatment of seasonal affective disorder. Additionally, there's a medication that has been shown to prevent seasonal affective disorder before it even starts in individuals who are vulnerable, and that is the drug Wellbutrin, which is known by the generic bupropion. Now, if a person wants to try something instead of drugs or before drugs, there's also good data suggesting that phototherapy, which is exposure to artificial light source, is a treatment for seasonal affective disorder. Not any source will do. In a room like this, we probably have 400 what we would call lux, and that has to do with the amount of wavelength and the eye sensitivity to light. In order to treat seasonal affective disorder, you need to get a minimum of 2,500 lux for about 30 minutes a day. So you would need to purchase an appropriate sort of light that confers that amount of wavelength and be positioned in front of it for about 30 minutes. And ideally, you would want to have that exposure in the morning, right upon awakening. And when I prescribe it, I tell people to get up and use the light box 6:30 or 7 o'clock in the morning. Now, if your light box isn't so strong to deliver a 2,500 lux per dose, you might need to be longer in front of the light box, maybe up to several hours a day. And there are some new light boxes with LED sources, and people are looking at those. They're actually a little more portable and a little less bright and might be more comfortable for people. So all of these are reasonable choices, and there's a lot of information on the internet and on our website where you can learn more about treatments for seasonal affective disorder.
Suppose someone feels they have SAD, they've tried the light therapy, maybe they've even taken a medication and it still doesn't seem to be working. What might they want to consider doing if
Yeah, if phototherapy isn't effective and the symptoms are really quite severe or incapacitating and it feels like something else needs to be done to get enough relief so that somebody can function and feel well, it's probably a good idea to consult your physician. A primary care doctor or a psychiatrist would treat this like other depressions, and as you may know, Jim, only about 1/3 of depressive episodes will respond to standard antidepressant treatments, and many folks will require a second or a third trial of a different antidepressant, or maybe some adjunct booster medicine added in to help get rid of all of their symptoms. So psychiatrists in particular, and many primary care doctors as well, are trained to know what are the next steps in using medication and also adding talking therapy to a treatment to help somebody feel full remission from their symptoms. And that, of course, is the goal, is to feel all the way well.
Thank you for getting together with us, taking the time and telling us about SAD.
My pleasure.